Now in today's show, I want to go ahead and talk about what is perhaps the most important infectious disease worldwide, and clearly the most important parasitic disease worldwide, and that's malaria. And the numbers are pretty large. According to the World Health Organization, malaria cases worldwide in 2017 accounted for 219 million cases. Primarily in Africa, but they're seen also in Asia, and we're seeing a lot of malaria now in Latin America, particularly in Venezuela. Now, of that total in 2017, 435,000 fatalities were reported, and a big percentage of that is in young children under 5. So let's take a closer look at malaria, the parasite. Now, the protozoa are broken down generally into the amoeba, the flagellates, the ciliates, and the sporozoa. And the parasite that causes malaria is a sporozoa. And the sporozoa include Plasmodium, which is the genera that causes malaria, but it also includes other ones such as Toxoplasma, Isospora, Cryptosporidium, and others. Now, unlike the amoeba, unlike the flagellate, and unlike the ciliate, the organisms of the sporozoa have an adult stage that is non-motile. They are also intracellular parasites, and they have very, very complex life cycles, as you're going to see momentarily, with asexual reproduction and a sexual reproductive stage. And as I mentioned, Plasmodium is the cause of malaria. It's generally considered that there's 4 true parasites of humans in the Plasmodium species, as they utilize the humans almost exclusively as a natural intermediate host. And these 4 include Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Then there are other simian malarial parasites that have been found in humans that cause disease. And we see a good amount of this out of the Malaysia area with a parasite known as Plasmodium knowlesii. We often call it in the media the monkey malaria. The Plasmodium species are transmitted by the female Anopheles mosquito. So let's go ahead and take a look at the life cycle of malaria, and it is very, very complex, and we're going to go through several slides to get through it all. And if we look right here, the mosquito, the Anopheles mosquito, will inoculate the infective stage, or the sporozoite, into the human host. In the human host, the sporozoites first attack the liver cells. So they go to the liver cells, they multiply, they mature into schizons, and at some point the cell will rupture and release the merozoites. And this is the completion of the exoerythrocytic cycle, or the cycle outside of the red blood cell. At that point, we get the beginning of erythrocytic schizogony, and this is also an asexual cycle. And the merozoites that bursted out of the ruptured liver cell now enter the RBCs, the red blood cells. And in the red blood cell, they go through a stage, right? They go through different stages. The immature trophozoite, or the ring stage, which were very common. Many of us know of this stage when we look at blood smears. And then it can go to a more mature trophozoite, to the schizont, and the cell will then at that point burst, and the merozoites will go out into the bloodstream again and infect more RBCs, and it's a cycle. Now, some of these parasites will go to a different stage. It's a sexual erythrocytic stage called a gametocyte. And at that point, the gametocyte is in the bloodstream, and this is what the mosquito is going to pick up when it takes a blood meal on a human being. And there's 2 gametocytes. One is the microgametocyte, which is the male, and the macrogametocyte, which is the female. and that completes the asexual cycle, or the schizogony stage. Now, then it goes into the sexual cycle, which is in the mosquito, and the gametocytes are picked up by the Anopheles mosquito when they take a blood meal. And then once in the mosquito's stomach, the microgametes penetrate the macrogametes, generating zygotes. Then the zygotes in turn become motile and elongated and become oocytes, which invade the midgut wall of the mosquito, where they develop into oocysts. The oocysts grow, rupture, and release the sporozoites, which find their way to the mosquito's salivary glands in the proboscis, and the cycle continues when they take a blood meal in a person. Some of those sporozoites go into the human being, and we got this long, complicated cycle of the malaria parasite. Now, there's several pathological symptoms that we can look for, and one, you'll see a cold stage, and this is very classic. You'll see it in the movies, whatever. This is this sensation of being really, really cold, shivering, teeth chattering. Then there's a hot stage, and we're also very familiar with that from, if you haven't experienced malaria, from movie and TVs, where people will get these horrible fevers, headaches, vomiting, and in young children, they can have really serious seizures. And then a sweating stage, a lot of sweats, then temperature returns to normal, tiredness. And what's interesting about the malaria parasites is these attacks occur basically every second day, every 36 to 48 hours, with the tertian parasites, which is all of the, it's 3 of the 4 species, Plasmodium falciparum, Plasmodium vivax, and Plasmodium ovale. So every 2 days, you will get this, go through these stages of symptoms. Now with Plasmodium malariae, that's Corton malaria, and that'll happen every 3rd day, every 72 hours. Now, concerning pathology, Plasmodium falciparum is clearly the most pathogenic. It is the one that will kill, and it causes severe malaria. And there's several different things that you can see with Plasmodium falciparum, all very dangerous, and probably the most dangerous is the cerebral malaria. And this is where the RBCs, the organisms, and the pigment block the blood vessels to the brain. And it can be seen with abnormal behavior, impairment of consciousness, seizures, coma, and other neurological abnormalities. And it can be fatal. Then there's a lot of severe anemia, because you have this mass destruction of the RBCs, producing a lot of hemolysis. Then hemoglobinuria, or hemoglobin in the urine due to hemolysis. This is often known as black water fever, and it's a sudden, massive intravascular hemolysis with blood in the urine. Now, some parasites of the malaria, of the Plasmodium species, will relapse, and you think you've been treated and taken care of, and then maybe months or even years later, it pops up again. And most notorious for this is Plasmodium vivax. And Plasmodium ovale has also been implicated in this. And this occurs in patients that have recovered from the first episode of illness, and they may suffer several additional attacks or these relapses, months or even years without symptoms. Relapses occur because Plasmodium vivax and Plasmodium ovale have a dormant liver stage, the hypnozoites, that may reactivate. Now, there's certain health conditions that you may have that would protect you from getting Plasmodium species or malaria. And that includes if you have G6PD deficiency, that's an inborn error of metabolism that predisposes the RBC breakdown. And this condition is very hostile to parasite growth. These aren't conditions you want, but I'm just saying that this would prevent people from getting malaria. These are all very serious. Some of these are very serious conditions. There's a blood group antigen known as Duffy, and if you're Duffy negative, you are essentially resistant from getting Plasmodium vivax malaria because the Duffy antigen serves as a receptor for the that malaria parasite. And sickle cell trait, and there's at least one study out that shows that there's about a 60% protection against overall mortality if you have sickle cell trait. Now, the diagnosis of malaria, the gold standard, the classic standard is microscopy. And the parasites can be visualized on both thick, here's your thick smear, and your thin smear, stained with either Giemsa right or right Giemsa stains. Ideally, the thick smears are used to detect the presence of the parasite. So you have this big, thick blob of blood here, multiple layers of RBCs. Those cells are going to be lysed, and you're going to be looking just for the presence of malaria parasites. You won't be able to identify it most of the time. And that's what the thin smear is for. So you'll look at the thin smear out here, just like you would, as if you were doing a white blood cell differential in a hematology lab, for example. So you got this single layer of RBCs, and then what you're going to look for is the actual morphological characteristics to try to identify and speciate that Plasmodium species. Now, there's other methods out there. There's molecular methods, antibody methods, antigen detection, but I believe this is still considered the gold standard throughout the world. Now, as far as Plasmodium, if you're looking at it under the microscope, there is 4 distinct stages that are found in the blood, and we're going to look at the 4 common parasites and the different stages. And the different stages found in the blood include the ring stage, right? We talked about that during the life cycle. This is the early immature trophozoite stage. Then there is a more mature trophozoite stage. Then there's the schizons, which divide several times to produce the new merozoites. And you may see gametocytes in the male or female sexual forms. So let's go ahead and start with Plasmodium falciparum. And here we have a picture of the ring stage. And they're small. You can often see oblique forms where the ring presses up against the side of the RBC. Oftentimes you see like this headphone appearance where there's double nuclear dots in the ring. It's not uncommon to see multiple rings within one RBC. Moorish clefts, these are finely granular precipitates or irregular cytoplasmic particles that usually occur diffusely in the infected RBCs. With Plasmodium falciparum, you can have very heavy parasitemia, and the parasites invade RBCs of any age. And if you do see a gametocyte, they're frequently crescent-shaped, also described as banana-shaped, and you'll see a picture of that momentarily. So in this photograph, you can see the double chromatin dots on the one ring, giving you that kind of headphone appearance. In these RBCs on the right, you can see multiple ring stages within the RBC. In this particular RBC right here, there's 3 rings. Here around the middle is the oblique form where the ring is pressed up against the side of the RBC. RBCs are not enlarged. It doesn't require immature RBCs. They're pretty much any RBC. And there's your Moorish clefts, these purple type dots in there, and that is found in Plasmodium falciparum. And here's a classic photograph of the gametocyte, and you have that crescent-shaped or banana-shaped large gametocyte. It's very hard to miss something like that. Now, Plasmodium vivax, while not the most pathogenic, this is the most common and widespread Plasmodium species on the planet. And typically you'll have one single large ring. You may see Schiffner's dots within the RBC, and these are little fine purple dots. Plasmodium vivax will only invade reticulocytes, so these are more immature RBCs, and so there'll be larger RBCs also because of that. The schizonts are large, and they basically almost fill the whole RBC, and you can have between 12 and 24 merozoites inside it. And if there's a gametocyte, they are typically round or oval. Plasmodium malariae. I guess the most classic appearance on a blood smear would be the band form trophozoite stage. And you can see how this one in the photograph, it kind of just stretches across the RBC. Now you may see stippling in the RBC, these fine pink dots. Plasmodium malaria also invade older RBCs. The mature schizont has about 6 to 12 merozoites, and occasionally they will appear in a kind of a rosette formation. And if there's gametocytes, they are round to oval, compact, and almost fill the RBC. And the last one is Plasmodium ovale. Very, very similar in appearance to Plasmodium vivax, but they're typically a little bit smaller. So you'll still see Schuffner's dots as you would with Plasmodium vivax and a single compact ring. This is perhaps this or Plasmodium malaria are the most uncommon of the 4 species. So anyway, that's Malaria 101. That's the basics. It's a primer. A lot of you may see this video and say, oh, well, this is nothing new. But no, this is a very basic introduction to Plasmodium species and malaria and its microscopic morphology. So I hope you liked it. If you did, go ahead and subscribe to the program, subscribe to the YouTube channel, share with your friends, and I'll see you next time.